Please read and understand the entire IFU prior to using all Neurovision Medical Products devices. Only an experienced clinician should select the appropriate device based on the patient anatomy and the relevant surgical procedure that will be performed. Please inspect the packaging and labeling prior to opening the single-use sterile device to ensure that the device can be used. Additionally, inspect the device itself prior to use to make sure that the device conforms to its specifications. Please note that only an appropriate and trained medical professional should use the device in any surgical procedure. Finally, please follow standard OR protocols and neuromonitoring protocols, if applicable, when using this device. This includes appropriate anesthesia protocols for use of EMG and EMG devices within a surgical setting.
Hi, today we'll be talking about the ViClean Laparotomy drape with integrated wound protector and fluid collection pouch, and how to use it properly in a surgical site. Once the incision has been made at the desired surgical site, begin by taking note of the positioning sticker on the drape and align it so that it is facing the patient's head. Next, squeeze the bottom ring to a moderately flat position and place it inside your surgical site. Then be sure that the two channels connecting the lower to the upper ring aren't twisted, and simply lay your drape over the surgical site. The first side that should be open is facing the patient's head, followed by to the patient's feet, and then both sides. From here, we will secure the tension between the upper and lower sites of the surgical field simply by rolling the left and the right side of the upper ring until the desired tension is reached. You're ready to proceed. Thank you.
Thank you for viewing this Neurovision Medical Products in-service video. For more information regarding any of our products, please view our website at neurovisionmedical.com or contact your local area sales manager. For clinical support, please call 866-815-6999 and select option 1.